It's 11 minutes after 9. Thanks for being with us on this Live at 9. With opioids no longer a preferred way of treating pain, doctors are working hard to find new ways to help people who are suffering. And one Mid-South clinic is now using a treatment that is proving effective. Dr. Cody Scarbrough is a pain specialist, and Kurt Gray is a war veteran and patient at Mays and Schnapp Neurospine and Pain. And they join us live this morning via Zoom. Welcome, gentlemen. Doctor, let's start with you. What is this new pain treatment, and why is it so unusual?
Hey, good morning. It's actually a new way to deliver nerve stimulation in the method of applying an electrical stimulus to a nerve for a temporary period instead of something that has to be permanently implanted into your body. And by doing this, you're actually changing the way nerves are sensing pain and kind of giving the central nervous system a break. It's a very exciting thing that we've had the ability to implement here.
Is it, for lack of a better word, sort of similar for the layperson to what acupuncture does, or that type of treatment?
Quite a bit different, actually. The best way to describe it is that we are changing the way nerves are sensing pain. And by delivering a stimulus or delivering an electrical signal to the nerve that is much more comfortable than the pain that is being sensed, we can change the way that that nerve actually perceives pain, hopefully for a much longer period of time.
Okay, so with regard to how it's treated, is it more frequent treatments at first, and then as you retrain the nervous system, you can do it less frequently? Or how is there at any point where your nervous system might be like completely ready to not have to need treatment at all?
Yes, the way that this device works is that we use a 60-day window to deliver stimulus basically every day for the entirety of the day. And what we're doing during that time is trying to interrupt that painful signal from the damaged area back into the central nervous system. And then after the 60 days, we actually take everything out. So you're no longer left with this device delivering the stimulus. And studies and science have shown, and as we'll get to, you're getting prolonged benefit in many cases.
Wow.
of actually getting pain relief despite the device no longer delivering the stimulus after 60 days.
Wow, how tremendous. Kurt, first of all, thank you for your service. Tell us your experience. Like on a scale of 1 to 10, where was your pain prior to this, and where is it now, and how long have you had the treatment and that sort of thing?
Well, Ms. Jenna, prior to this device being placed, I was probably at a good 8 to 9 pain level.
Wow.
This device has cut, my opiates back tremendously. It's painless, and I recommend it to anybody that's dealing with pain.
Is it one of those things that, other than the greater absence of pain, you almost don't even notice? Like, you don't feel the electrical stimulation at all, right?
No, ma'am, you do not. And I mean, it takes a lot of pressure off your nerves.
Wow. So I've always heard that chronic pain is one of the worst things you can go through, not just physically, but emotionally and mentally, that it is extremely draining, and it can also lead to, like, frankly, depression.
It has, and it's definitely a hard thing to go through, chronic pain.
How quickly did you see an improvement?
I was, probably within the first week, I noticed a big improvement, and it only got better. And I'm still, feeling benefits from this device.
That is fantastic. So, doctor, this is a device that's actually implanted. Kurt doesn't have to come in, for instance, weekly initially or daily. It's you put it in once and then just check up with him periodically. Is that how it works?
Correct. The device itself is actually implanted through the skin, and a tiny little wire about the size of a hair is actually sticking out of the skin, corresponding to which nerve that we're targeting, and it's hooked up to a small little battery pack. and the battery is changed every day, and it's constantly delivering the stimulus to that nerve to be able to override that pain signal.
Wow. Is it covered by insurance?
It is. Yes, ma'am, it is.
Fantastic. Thank you so much. Appreciate the work. And Kurt, again, thank you for your service to our country.
Thanks for having me.